touch-based feedback. So these are little patches that you can apply to your forearm. They have textures to it, and your skin, the mechanoreceptors in your skin, they pick up that stimulus and they send it back to your brain through the spinal cord for interpretation, and that can actually improve your body awareness and your proprioception and just how you move. So again, coming back to just different issues that neuropathy creates. Okay, so the big takeaways from today. So successful neuropathy care often looks like nerve stimulation, balance training, okay, because your balance is going to be off when you can't feel the bottoms of your feet for a long period of time, strength exercises, so strengthening your legs as well, circulation therapy, that might look like electromagnetic therapies or red light therapies, and then nutrition support. So that's low glycemic eating, especially for people that have high blood sugar. We want to keep those glucose spikes down, okay? Because more glucose spikes results in more insult and assault on the nerve, okay? So the treatment goal here, the goal is, obviously we want to reduce pain, improve sensation, improve your balance, and then restore walking confidence. So that holistic, whole body approach, it's not just take this gabapentin, it's not just live with it, it's not just you're old, whatever you've been told. There's other things that you can do, but it's a multifaceted thing. These are all like meant to help support and build off of one another. No one thing is going to fix it. Like not just nerve stimulation, not just circulation, not just strengthening, not just massaging, not just soaking, not just changing your vitamins and supplements and the way you eat, but it's a holistic approach. So as a thank you, everybody here, you've probably talked to Julia, I'm sure. We're inviting you guys to do a neuropathy screening for free. What that includes is we'll look at your nerve health. So we'll check the health of your nerves in your legs. We'll do balance testing. We use a thermal camera, so thermal imaging to see circulation issues in your feet and legs. And then we can offer you a personalized treatment plan if that's something that you're interested in. Okay? Like I said, that's free. If you guys are interested in that, hang out at the front with me. We can schedule something together. All right, we do 10 of these a month. We always fill them up, so if it is something that you're interested in, come hang out, and we'll get something reserved. Me and Selena will help you with that. Do you guys have any questions? Can we open it up for Q&A? We've kind of answered like a hodgepodge. Yeah, go for it. All these, everyone's going to have kind of like an individual circumstance, and there's so many things that can cause your symptoms, and the best way to address that is to really like, probably for you to get a screen, because some of that could be coming from your back, like some of it could be just some kind of neuropathy, it could be from your history with the aneurysm. Again, you got to find the cause. You have to understand the cause of what all of this is, and the best way to do that is just like, if you're like, oh, what's causing this, come see me, like, you know. But any other questions about just like how, yeah, can we take this one over here?
Yes, I'm a diabetic, but I didn't have the neuropathy from that being a diabetic. I got neuropathy from taking chemo.
Yeah, absolutely. That's what it does, right? Like, it's insane kind of how when you have an insult to your nerves, what you feel.
Yeah.
Yeah. Neuropathy, chemo-induced neuropathy responds really, really well, because once the assault on the nerve is gone, like, you can really fix some things, right? Because a lot of people want to know, like, can neuropathy be cured, or is this something that I'm just gonna have to manage? Some neuropathies can be cured, and when the assault and the insult on the nerve is gone, or managed really well, then you've got an environment where you can heal. Okay?
So you're saying because no longer is taking?
The assault on the nerve is gone, right? that's done. You're in remission.
Yeah.
And that's what happens with neuropathy. It's so unfortunate, right? Because your world gets so much smaller because you can't pick up a penny, you can't stand and be there for your family, but this is real life. Like, this is what people deal with and struggle with, and then the help that you're given might be gabapentin or something like that. Yes.
Okay, and the biggest thing is since then, I don't sleep well, because of these feelings. Not in the daytime, doesn't bother me too much, but at night, and I do fit, do different types of stretching, 3 or 4 times a week, different types of exercises. So I've had to resort to taking Ambien, and I don't want to do that. So it's got to be somewhat in between.
Yeah, you've addressed the circulation, the vascular piece of it, and then maybe what's left is that neurogenic piece, like the nerve piece.
They said I had a tiny vein.
Okay, yeah.
And it said it has to be rerouted.
Yeah. It's kind of, they'll do that. Your vessels will do that just like your nerves will. They'll branch off. They'll make little collaterals, and sometimes they can get bigger than your actual veins, the primary veins themselves. So, but yeah. Great, yes. Right. That's what I want you guys to really take from this is like, you got to draw from a lot of different places to get the solution, right? It's not just the physical therapy. It's not just the stem pod. It's not just the vein treatment. It's more. There's more to it than that. Go. Let's go, Ms. Linda.
Okay. Can you tell us a little bit about the red light therapy? What is that like?
Oh yeah, red light's great. So red light. So I like to think of our bodies absorb all sorts of different colors, every color of the rainbow, and then what our body does with that is very unique. So when we're talking about red light, the body cells absorb red light and it increases the production of ATP. ATP is like the energy, the powerhouse of the cell. So it makes our body more efficient at doing what it does. It just makes us do it better, right? So it actually, like, we use it a lot for, we'll use it a lot for like osteoarthritis, knee pain. It helps to reduce pain by kind of moving inflammatory cells and chemicals out of the area. It vasodilates. So it's actually great for edema reduction. So people that are like really, really swollen from arthritis or various different things, soft tissue injuries, it's so healing for that. But yeah, it's amazing. It's a great modality. We can have a whole conversation about red light.
Yeah, so
Yes.
even with knee surgery, it helps with, and even after you had that done?
It's great after surgeries.
Oh.
After surgeries, red light all the way for sure. I think we've got a question right here.
I'm sorry.
That's okay.
I was wondering about long-term COVID.
Okay.
What is the main cause that so many of us have this? I mean, I have to get it down to the science of what's happening. Could it be long-term COVID? Could it be knee replacement? I had 2 of them. Is it sciatica? What's the deal here?
Yeah, so I think there was long COVID in there. Like, you're kind of like, is it that we have all long COVID? Because like, not everybody in this room has had long COVID, right? But everybody in this room has neuropathy. So we can't be like, it's because you have long COVID. It's because you've had a knee replacement. We have to, each person's situation is unique, and we have to dial in on what is the cause. But it is going to be, no matter what the cause is, the solution is that holistic approach. We have to figure it out. You have to, maybe you have to do some blood work. Maybe you have to just make sure that you're getting adequate circulation down to the peripheral extremities. Maybe we have to do a nerve screen, right? And just check. Maybe we need to put the thermal camera on you to see. I did this with one guy the other day, and his whole foot lit up red, which is good circulation, except for one toe was blue. One toe was blue, and that was the one that he had terrible feeling in, like tingling and pain, right? So it goes back to, yes, there can be so many causes. It can be so, with that whole slide, right? Autoimmune, infection, COVID, right? So yes, could it be that where there's an assault on your nerves? Sure. But everyone's situation is a little bit unique. Yeah.
Exercise
We
good for you?
Oh my God, yeah. Yeah, exercise is great for you. Again, it's one thing, right? So we gotta do the other stuff. But yes, exercise is a piece of that. You should be working circulation. What a lot of people don't understand is that the veins and the arteries, they do different things, right? The arteries push blood away from the heart. The veins bring it back. But the veins, especially down in the legs, they get the help from your muscles. They act like a pump to push it back up to your heart. So if you're not exercising your legs, you should be. But a lot of times you can't because it hurts. It hurts to stand, or you're weak, right? So yes, it's a piece of it. Yeah.
Stem pod work for other things like backs and hips?
Absolutely. I'm using it on a lady right now. She's had a full lumbar fusion, bilateral hip replacement. She's been having bilateral hip pain for years and years. She had injury to some of her spinal nerves, so she couldn't hardly lift her leg. She's lifting her leg now to 100 degrees. She has no pain in her hips. She can sleep on her sides at night. So yes, it's great at helping with pain as well. Yep.
I think my main problem is my right hand, but I think it's probably from using it for much of my life. I mean, I've done all kinds of construction. So I'm thinking it's arthritic, but would it be worth having you all look at this?
Yeah, oh my God, we help arthritic hands all the time. Any thumb, is it your thumb, is it all the fingers?
Well, when it happens, the whole thing kind of freezes up. You know,
Yeah.
it's like I'm doing something and then all of a sudden, like I might be trimming a tree or something.
Oh, yeah.
It's like, oh, I can't do another branch.
Yeah.
It's like,
Yeah,
do you
absolutely.
all work with that?
Yes, yeah, all the time. We do all the time. All the time.
This kind of technique would help with that?
It could. The stem pod might help. Like I said, there's nerves that come down through here,
Okay.
and they help control the fingers as well,
Okay.
right? Sometimes it does. Here we integrate it. So the question is physical therapy and Pilates, like, is that always combined? Not always. At this clinic, you're sitting in our Pilates studio right now, we do combine that most of the time. Most of our patients need some sort of core stability. They need an option where they can move their bodies comfortably and confidently. And Pilates is very sustainable, it's very healthy, the principles are very strong and well aligned with what we do. So yeah, that is one thing we do very uniquely here that other places don't. The kind of device, because they're not all medical grade. Like if you're getting something on Amazon and it's like $34.99 or something like that, you know? Yeah, I mean it might be, but they have different wavelengths, and so you need to know like what the therapeutic wavelength is. So some of them are the real deal, and some of them are like not medical grade. Yeah. Yeah, all of ours are grade 1, grade 2 medical class devices. It's an antimicrobial, so that's a blue light, antimicrobial, helps your lymph system move. So if anyone's ever had like lymphedema or swelling, blue light's great for that. It helps stimulate your lymph. But the cool thing is, we worked on Carolyn at the knee and at the ankle, but the nerves are kind of like it's like a subway system, right? It's like one line and you can get on at different points, right? But it stimulates that whole line. Thank you for coming on your Saturday morning. I hope everyone learned something. My hope is that everyone learned that tackling neuropathy is a multifaceted, holistic approach. There's not just one element. It's not just strengthening. It's not just circulation. It's not just diet. It's all of this. If you guys really are serious about getting some relief and in making some improvements to your life and making your world bigger, you got to look at it from all the different angles there, okay? It's not easy. It's like the habit, right? That neuroplasticity. But it's possible.